Our next guest is Dr. Siew Lim, a Senior Research Fellow and accredited practicing dietitian at Eastern Health Clinical School at Monash University. And topic that I wanted to ask you about was priority population. Talk to me about that. What is priority population, first of all?
So priority population is one of those terms that can be controversial. But basically, in layman's term, I would understand that as underserved populations and also population at high risk. So in my research, the priority population that is close to my heart is Chinese women, reflecting my own background. And this year, we've been funded by Endometriosis Australia to start a conversation with Chinese women with lived experiences of endometriosis to ask them about what we could do further to actually increase awareness of endometriosis in the Chinese community. And
what are you finding, just early stages, I appreciate in your research, but also personally within the Chinese community in relation to accessibility, understanding, treatments and the like for endometriosis?
So from the preliminary interviews that we've done, what's been really surprising and heartbreaking is that it's actually a lot of the symptoms underlying endometriosis are actually normalized in the Chinese community. So painful periods, for example, are actually seen as a normal part of growing up as a girl. So that actually leads to a very long diagnostic period where women are actually suffering in silence for many years before they realize that something could be done and they could actually be living a different life with better quality of life with the right treatment and management. So in the research that we've done, we've actually asked these women about how can we help other girls and women to actually seek help? How can we empower them to identify symptoms and ask for help?
And in terms of then the dietary elements, how the Chinese diet, for example, comparative to the Western diet in treating this?
That's a really, really good question because the strongest evidence today, that, as I've mentioned, is the Mediterranean style diet. If you know anything about the Mediterranean style diet, it's like North and South poles in terms of, Mediterranean and Chinese diets. I think that would be a really important thing to remember and to recognize that in and of itself, it's not really culturally appropriate for everyone around the world. And accessibility to these ingredients is also an issue for people who live outside the Western food supply as well. So I don't think it will be daring to say that we actually need a more culturally diverse anti-inflammatory diet to be trialed so that other people around the world could also benefit.
Well, joining me now is the founder of the Endometriosis Foundation of Kenya, Elsie Wandera. Tell me a little bit about the Endometriosis Foundation of Kenya. When was this born and why?
So it's 10 years, so it's actually a 10-year anniversary. And I feel like it's such a privilege to be celebrating it here during Congress. It started, it's actually, my story, my pain that, and through it, I started the foundation.
You're speaking here at Congress this afternoon. Give us a little bit of insight into your presentation, what you'll be addressing.
So we did a study on the psychological burden of endometriosis in Kenya, of women in Kenya, specifically Nairobi. As you are aware, there is very little representation of especially Africans and low middle income countries for that matter. I think the reason for it was just to make sure, because this is my second Congress, and even before I started the foundation, there was little data on the impact of the disease from an African, but this just absolutely, it's sparse, it's non-existent, it's not there anymore. So the reason for me presenting was just to make sure we bring the Kenyan perspective and so that, we could actually bring the Kenyan voices onto this global platform and to just ensure that we are included in the global data set. And, that's why I'm here. And I'm here to say, hey guys, would you be interested in coming to hear our perspective? Because there's such deep community knowledge that we have to offer, and a different perspective. I think one of the gynecologists, again, that we work with, the clinician that we work with, who is ex-Oxford, said to me that, Elsie, the way that endometriosis presents in African women is very different from the women up, in the north. And I was like, but isn't that something that you should actually present to researchers so that they know if they're trying to find a cure or a cause, it might actually mean them actually coming to our context and understanding what is going on within our context, what could be contributing to the inflammation or just the disease progression. But I think that's why we need this voice. Like, that's why we need the representation, and it's not necessarily just for us to be here physically and say, oh yeah, we just, we're here to tick boxes. When it's not about ticking boxes. We do want solutions. We do want, because like when you think about the delay in diagnosing, for example, for women who come from my country, many are still undiagnosed to date. So it's not to say that we're not doing enough, but the stigma, addressing the stigma, addressing the taboo around the topics and conversations around menstrual and, just sexual health in general. Like, it's difficult to just cut through that barrier. So I think for me, it's important for us to be here and to be represented, and to then say to the researchers, we would like to connect the patient's perspective, the patient's lived experience to the work that you're doing, to just enhance it and make it that much more richer.
We are so incredibly grateful to have you here. I could talk to you all day. You're just remarkable. Please know I'm only ending this because you have a lecture to get to. You have to go and present.